Hello and welcome to yet another episode of the 𝗂𝗂𝐁𝐵𝗲 Show, where we talk real issues and real solutions in women's health. Now, today's episode we focus on one of the biggest decisions that women must make, choosing the right birth control. With so many options, how do you know which is best for you and your body? My name is 𝗂𝗂𝗁𝗲𝗂𝗃, and to help us unpack all this is a seasoned gynecologist. His name is Dr. Stephen Mutiso. Thank you, sir, for having us.
Thank you.
All right. So, Doc, can you just take us through all the birth control methods available today for women?
Yeah. So the birth control methods available are many. They range from natural methods and also the modern methods that we have.
Yeah.
So the natural methods are divided into groups. The common ones we have include using the calendar so that the couple can avoid sexual contact during the fertile period. It also includes methods like withdrawal, are part of the natural methods. But modern methods, we have methods like the pills. The pills, we have the combined pill, which is the most popular, but we have also the progesterone pill, we call it mini pill, used mainly by breastfeeding mothers. Then we have the the barrier methods. A good example is the condoms. In this category, we have both male and female condoms. And then we have intrauterine contraceptive devices, IUCD. And then we have methods like implants. The commonest we use is known as no plant, which is put under the skin. Then we have even methods like contraceptive patches, skin patches, vaginal rings. All these are methods which are available. Then we have the permanent methods. Permanent methods means once we choose these methods, it cannot be reversed. That's it. And in this category, we have tubal ligation, which is done for females. And then we have vasectomy for men. Yes, so those are the methods we have.
Now, with all those options, like, for example, a woman, especially after giving birth, or you just want to be under a contraceptive, how do you get to know which one is best for you? Like, what are some of the factors that, because are there some as an expert that you would say you recommend for women?
Most methods can be used by women. Most methods. But there are special cases, special contraindications we look at. And this is where we are able to determine who can use what and who can't use. For example, one has to be cautious. For example, during breastfeeding, there are methods which will reduce milk production, and therefore those ones will not recommend.
For example,
during the breastfeeding period. For example, the common pill, the combined pill, commonly marketed as microgynon, and those ones, they reduce milk production, and therefore we don't recommend them during breastfeeding period. And then women who have had maybe problems like blood clots, there are some methods these women should not use, like the pills, the combined pills, because they increase the risk of blood clots. So we go through the medical history to determine which is the best method one can use. And then we discuss the various options, the advantages, disadvantages, and then finally the couple or the woman is able to make a decision.
And when you're looking at these factors, because I understand there are hormonal and non-hormonal contraceptives. So if, for example, as a woman, I might not know whether to go for hormonal or non-hormonal. So for these two categories, what factors should women consider, or do you advise women to consider when choosing whether a hormonal kind of a contraceptive or non-hormonal?
Yes, so if once someone fits the criteria for either hormonal or non-hormonal, then we discuss the methods, the advantages, then the side effects profile, and from this one is able to make a decision whether they are going to use hormonal method or they are going to use a non-hormonal. Yes.
All right. And for purposes of women out there who are not able to access specialized care, maybe you can break it down for us, take us through some of the commonly used hormonal and non-hormonal contraceptives. Just a few pros and cons for them.
Right. So when we look at hormonal contraceptives, the commonest used is we have the combined pill. Yeah. So this pill, of course, has several advantages. You find it helps to regulate menstrual cycle. It also helps a lot, especially in women who have pain during menses. It helps to reduce this. And actually, it's easy. It's available. It's easy to take. It's cheap. It's widely available. So does not require really one. Want to spend money when it comes to when the method is being. To utilize the method. So it's an easy method to use. The only the common side effects we see for women using this include nausea, vomiting, especially when the bodies are just getting used to it. And then sometimes you may have dizziness and headache. And then on the extreme, then we have rarely do you have a failure. Yeah, because all these methods can fail.
Yeah.
But the pills they're very good once you take almost when you take the pill almost the same time, and you don't have to skip.
But it's not easy to stay consistent.
Yes, it's not easy, but one should try to take these pills almost the same time and to make sure they don't miss the pills, so that we can get maximum effectiveness.
Yeah. So you've mentioned something that women struggle with a lot, especially if one is aware that if I use this birth control, then it's going to sort out my period pain. So that's now the pill. So is there another option for the same, like another hormonal contraceptive that has the same effect?
So we have medicated or hormonal intrauterine contraceptive devices, IUCD.
Yeah.
These ones can be used actually to relieve menstrual pain. It can also be used to reduce bleeding for women who bleed a lot, those who have heavy menses.
Yeah.
So that's one of the considerations one can use the hormonal IUCD. Yes. And then other hormonal methods we have include the implants. So the NOP plant, Implanon, Jadel, these are some of the examples in this category. They are common methods, and of course the advantage is that one does not have to remember to
take the pill,
to take like the pills every day. Once it's inserted, that's it. The method can be used for the prescribed period, either 3 or 5 years. And then the other advantage is to some people. So you find sometimes the periods they don't flow as regular. And
it's an advantage.
It's an advantage. I know many people look at it like an disadvantage. It's an advantage. And women are able to build up their hemoglobin level to good amounts. Yes.
Okay. And staying with the hormonal, I've seen some women complain that, after I had this implant or any other IUD, I gained weight, I lost weight. Are these some of the side effects for hormonal contraceptive?
So the weight gain attributable to these hormonal methods is very small.
Oh, really?
For example, like for NOP plants, a lot of research has been done on this, and the weight gain per year is about 1 kilogram. So you can see,
So we are just
sometimes we blame the methods.
But it's just our
but probably it's our lifestyles, maybe what we are eating, and also maybe sometimes failure to live a very active lifestyle.
Because docs, most women, not some, are really, really scared of the hormonal contraceptives. They say, no, I don't want my body altered, interfered with, especially with missing of period, and also especially on gaining and losing weight and all those other side effects. So you've said that it's not attributable to the hormonal contraceptive. So maybe you can just list for us some of these just non-side effects that a woman choosing hormonal contraceptive might expect?
So for women using implants, the common side effects we see is change of the cycle.
Yeah.
Sometimes the periods don't come. Sometimes they come after some months.
Mm-hmm.
And then once in a while, there may be some bleeding.
Mm-hmm.
Sometimes the bleeding and spotting may be a bit prolonged.
Yeah.
So these are the common side effects we see. And then also issues to do with sometimes mood changes, headache. These are common side effects we see with the hormonal methods like implant.
Yeah. Okay.
Yes.
And now for the hormonal, which is, of course, most women will just be like, no, just go for the hormonal. Why are they so famous? Maybe you can take us through some of the hormonal contraceptive methods, and if possible, are they better according to you as a doctor than the hormonal contraceptive, the non-hormonal? Sorry.
Okay.
Yeah.
So before I go to non-hormonal, there is also another method which is very popular, the 𝗍𝗶 injection.
Yes.
Which is given every 3 months. Yeah. Again, this method has similar side effects like the implant. Yeah. Sometimes there may be a change in the menstrual cycle. Yeah. So you find women don't get periods very often.
Yeah.
And sometimes there may be bleeding and also a bit of dizziness, a bit of headaches, and also nausea.
Yeah. Okay.
Yeah. So for the non-hormonal methods, the commonest we have is the IUCD. We have IUCD, the intrauterine contraceptive devices, which is commonly used, is actually non-hormonal. Yeah, it's non-medicated. It's popular because it's natural the way it works. There's really nothing which gets into someone's body, and for this reason, it's quite popular among many women. These methods, the good thing is once it's started, one can use for a prescribed number of years, many times 5 years, sometimes up to 10 years. So it depends on what one is using. Yeah, so the common side effects we see with intrauterine contraceptive device include increase in period pain. Some patients some women may experience increased pain during periods, and then also bleeding.
Yeah.
Yeah, sometimes the bleeding is heavier than usual. There are a few cases where the coil can come out.
Yeah.
Especially if there's a lot of cramping and a lot of bleeding, or it can get displaced.
Yeah.
Yes. Yeah.
Okay. And so, Doc, maybe as we wrap it up, is there this one method that you'd recommend for women, especially those that are seeking a long-term protection and those that are also seeking, let me call it peace of mind? Like once I have this, I am settled maybe for the next this period of time, or even forever if someone is not looking forward to having kids again. Yeah.
Yeah. So the appropriate method depends on the person.
Yeah.
There are women who don't like invasive, very invasive procedures.
Yeah.
And for this reason, the implants become the best, because it's just a minor. The insertion is very easy under the skin.
Yeah.
So when one is using this method, they don't feel like they've been exposed too much. But there are also others who may be comfortable with using intrauterine contraceptive devices. Again, this is a good method.
Yeah.
And it can be used by most women, because the women with heavy periods, they can use the medicated, the one with the hormonal one. Those without, they can use the non-hormonal intrauterine contraceptive device.
Yeah.
So these are good methods one can use for long-term protection. And the good thing is that they're reversible. They're not permanent. They can be discontinued at any time if there's a problem. Yes.
All right, Doc. So as we wrap it up, what advice would you give to someone who is just getting started with contraceptive?
My advice for someone who is starting up with contraceptive is that contraceptives, they're important, and they promote good health.
Yeah.
And They help one in planning when to conceive, which is very important.
Yeah.
It also helps with child spacing. Again, this is important to allow the other child to grow.
Yeah.
So contraceptives are important.
Yeah.
We need to use them.
Yeah.
We need to use them for purposes of child spacing.
All right, thank you so much. That's a good note to wrap it up. It's good to use contraception for child spacing. Thank you so much, Dr. Stephen, for making time for us. And thank you too for watching. It's been exciting having you here. And if this episode has helped you or someone, just please like, comment, and share. Don't forget to subscribe. And I'll see you again next week, same place and same time. My name is 𝗂𝗶𝗃𝐁𝗄𝐿. Bye-bye for now.